Hey folks, wanted to talk to you a little bit about Facebook. So I was looking at Facebook the other day, and having worked the ER for a long time and as both a nurse and then as a nurse practitioner, I kind of noticed that there are people who post things on Facebook while they're in the ER to complain about the people taking care of them. So I thought, the people who work the ER work really hard, and they oftentimes go without lunch. They oftentimes go without using the restroom for hours at a time because they want to take care of people. So I thought about starting a little video series to kind of talk about what actually goes on in the ER that the public may not be aware of. So the first thing I want to talk about is, what's the ER for? The ER is for emergencies, things that may cause you to lose life or limb in the next 24 hours. Now, emergencies are very personal to people. What you may think is an emergency may not be what the people in the healthcare industry think are emergencies, because those people are dealing with life and death. Many times they've resuscitated people several times during a shift, including children, young adults, middle-aged adults, and old adults. They've dealt with, terrible tragedies and traumas in the emergency department. So if you're there and you have a runny nose or you have a cough or something like that, they certainly want to take care of you, but they have to prioritize, because certainly if you were in the emergency room, you would want to be prioritized by your acuity. Acuity being the sickest people are treated first. So the first thing I'd just like to say in this first video clip is, if you are in the ER and you can post on Facebook about how slow the ER staff is or how long you've had to wait, you probably shouldn't be in the ER. There are a lot of clinics, I own one, a lot of friends own clinics, that are there to keep you from having to go to the ER, because nobody wants to go to the ER unless they don't have another option, or that's the way you would think it would work. But again, if you can post on Facebook about the ER staff, you probably should not be in the ER. Now, I want to say this. The ER people that I've worked with at lots of hospitals are excellent people. They do a good job. So the next time you're in the emergency room, please make sure to thank the emergency department staff. That's the physicians that see you, the mid-level providers, the nurse practitioners, the physician assistants, the nurses, the secretaries, the registration people, the techs, the paramedics, anybody that you see. Take time to tell them thank you, because you know what? They probably don't get to eat lunch that day, especially if they're busy. They've probably been needing to use the bathroom for the last couple hours and have chosen not to, so they can keep taking care of people so you can get care in a timely fashion. So folks, please just try to be patient, and know, if you're posting on Facebook in the ER, probably don't have an emergency. We'll see you next time.